You're like,
Okay, are we around 7 o'clock, everybody? Okay, so welcome everybody. We're doing our live event tonight. We're talking about, pardon me?
You just gotta give some time. For
Okay, we'll take our time here for a few minutes. This is Lisa Henry, okay? Michelle Blondale. These are our body contouring experts. I'm John O'Malley. I don't know what my expertise is, but these girls are the experts in this. You ready to get going?
You just sound checking.
Okay, we're just doing a little sound check. Check, check.
2, 1, 2.
Okay, we're good. So we're here tonight at MedAesthetics. We're actually in our, if you haven't been here before, we're in our main reception area. It's just better for the acoustics and for the internet tonight. So this is where we're set up. Okay, so we're talking about body contouring, and body contouring here at MedAesthetics includes CoolSculpting. And you probably can't see it, but we have 2 CoolSculpting devices. So it's called CoolSculpting. We're the only clinic in Sarnia that has that. And then we also have the EMSCULPT. So we'll start off tonight by talking about CoolSculpting, and then we'll move on to EMSCULPT. Okay. So what is CoolSculpting, ladies?
Number 1, non-surgical fat reduction treatment.
Okay. Yeah. So we have a lot of patients that come to us. They're kind of exploring some treatments to reduce fat. They're looking at non-surgical versus surgical, weighing out the pros and cons, and part of their journey we'll often have them come here and we'll speak to them and we'll give them some talk about the benefits of using CoolSculpting as a non-surgical. So the great thing about it, it's little to no downtime. It's safe, predictable, natural results. It's not a weight loss regime. It's not a program for weight loss. It's really for those stubborn areas of fat that you just can't get rid of. So we all know what they are. Everybody's bodies are different, but there's certain areas where you're working out, you're doing everything you can do, and you still can't lose those areas. So the technology, how it started, it was called popsicle
Paniculitis.
Okay, so
doctors at Harvard noticed that when kids were eating popsicles, they started to get a dimpling in their cheeks. So that they realized then that the popsicles and the cold from the popsicles wasn't affecting the skin around it. It was just those fat cells.
Yeah.
And from that, they discovered CoolSculpting.
Okay, so that's how it kind of works. So you basically freeze the fat cells, and it doesn't target the skin or the surrounding organs or tissues, which is pretty amazing. And when you do this procedure, if you just show Michelle one of the applicators will kind of suck your tissue in, your fat into it, brings it down to minus 11 degrees Celsius, and that process is called cryolipolysis, and it breaks down your fat cells and destroys them. So when you do a cycle, you can destroy 20 to 25% of your fat cells. Those are gone forever, which is great. So even if you start having a bad diet, you gain some weight, you're gaining weight and you're increasing the size of your existing fat cells. Those fat cells we've taken out using CoolSculpting are gone permanently, which is amazing. So that's, as I said, after you do it, like your body will actually get rid of the fat cells. It goes through your lymphatic system. So after you do a treatment, you need to drink lots of water, clears it out, flushes it out. So that's kind of the key to it. So what happens? Who comes here looking for CoolSculpting? We get calls every single day from people just asking what areas they can treat. So what areas do we treat, ladies?
So we can treat the abdomen, your flanks or the love handles. We can treat under the chin, your arms, or your inner and outer thighs, also the bra fat and on the back. Okay,
so people have those stubborn areas, they know what they are, and they call us up and say, can you help me? And we say, of course we can, and we book a consult. So Steve is here tonight for a consult. So Steve, thanks for coming in. So we're just going to bring it through. So Steve would arrive and he would say, Lisa, I'm frustrated by an area. What bugs you?
Midsection, love handles, the targeted areas.
Target areas, okay. So summers, drinking beer, hanging out, barbecues. And this is another good reason why we're talking about this today, because if we start your journey today, we'll have you beach fit by June.
By summer.
Okay? By summer, by boating season, okay? So what would happen? So Steve would come in and say, hey, I have some areas here I'm not happy with. You would perform a consultation on him.
Yeah.
And what's involved exactly?
So during your consultation, we would assess the area that you're wanting to treat. And then we would discuss how many cycles we would need to treat that area. So we have a couple different templates that we use here. So we would actually pinch around on your abdomen or your flanks or whatever area it is that you want to do.
Let's pinch around. Okay, for example, so
up.
can just stand up.
So if it's his flanks, We would be pinching around, looking to see the orientation of the fat, how much fat he has in that area, checking with these templates too to see how many treatments he could actually do and how many cycles he may need.
Okay,
So we'll
so
make a customized treatment plan for you.
okay, so you come back and say, okay, Steve, you're going to need. You have a seat there, Steve. You come back and say you'll need 3 applicators maybe to your flank, and you'll come back next week. We'll do the treatment. It will take 45 minutes to an hour. How long does it take?
So each applicator takes a certain amount of time. So with our smaller applicators, the advantage, they take about 35 minutes. On the chin, those can take 45 minutes. We have other applicators that take an hour and 15 minutes, or another one that takes 45 minutes.
So another example, another good reason to be coming here is we have 2 machines. Okay, so time is valuable to everybody. So you don't want to be here for 6-7 hours getting treatment. Time can be reduced in half, which is pretty amazing. So what does it feel like when it's happening?
So there's a vacuum in the applicator, like Michelle was showing us, and then it draws the fat into the applicator. The first 5-10 minutes, it can be a little bit uncomfortable. It kind of feels like when your fingers are frozen in the wintertime and you put them under hot water, they're kind of achy and stingy. It's about 5-10 minutes of that, and then you go completely numb. You don't even feel it anymore.
Okay, good. And is there any downtime?
No.
So you just walk out the door when you're done?
Yeah,
No
so you can be quite swollen after. Swelling, having some numbness is very common for about 3-4 weeks after your treatment.
Okay, so when would you see them back, Michelle?
We have them back at 3 months.
3 months, okay. And what would Steve expect to see after 3 months?
Probably a pretty good reduction. He might need 2 treatments. It just depends on how much fat there is in the area.
Okay.
But we'd always do a reassessment, see how the fat is kind of presenting at that time, and then
So you can have a
make
look
another
at,
plan.
so you'd know prior if somebody is it a 2-person treatment?
You
or
usually
1-step,
know,
2-step?
yeah.
Okay, you know
Yeah.
ahead of time. And that also helps with budgeting and figuring out how much you're going to spend on the treatments. Okay, we can talk about
Yeah.
costs after, but that's all. We sit down and we make a customized plan. We look at people's budgets, and most patients and clients who go through this journey, it's in their advantage to join our membership program, which gives them automatic discounts. So right away you'd be a Sapphire member because you're going through this treatment, and that gives you a 20% reduction before we start. And we're always doing offers. So right now we have an offer where we're giving buy 5 get 1 extra cycle free. Okay, so these are great deals for everybody, but we can sit down and go through them with you in person. Okay, so some questions people may ask or who have asked before. Are there any people who can't get CoolSculpting?
So if you're pregnant, breastfeeding, or if you have a hernia in the area that we're treating, usually that would be an umbilical hernia.
Okay, so pretty much, unless you're very cold, you have some sensitivities to
Yeah.
cold, or have a hernia right in the area, it's pretty good for everybody, which is one of the advantages of this over some surgical procedures that are out there. Okay, what sets us apart from other clinics that do this? Because if you're doing this, you'll do your research, and it's like a lot of things we do here. It's not just Botox for Botox, unit for unit. There's a lot more that we do here at this clinic. There's a lot more medical support, nurse practitioner support, training. I'd say the level of training.
Mm-hmm.
So we've done more CoolSculpting than any clinic. Would you say? Is there any?
Yep.
Yeah. Okay.
The dual sculpting.
CoolSculpting.
We also have a beautiful CoolSculpting room that has Netflix. There's a nice little lounge chair.
Yeah. So it's a comfortable experience for you, besides the fact that you are being frozen.
Yeah.
But, it's all good besides that. Okay. And when we talk about your ideal candidates, who's an ideal candidate?
So you want to be within about 10-20 pounds of your ideal weight, but anyone that's really looking to get rid of stubborn pockets of fat, that no matter what you do, you diet, you exercise, but you just cannot get rid of them.
Okay. So we talk about different areas to do. So we talked about doing your arms. Okay. So you can see before and after. These are our patients here. This is after 1 treatment, which is great. We also treat under the chin. So you can again see the improvement here. This again is after 1 treatment. Okay, and here you can see the abdomen as well, so you can see the improvement there. So how many treatments was that, Lisa? Do you remember?
1.
One treatment. Yeah, so you can see that. You can see the difference there. So these are
2.
Yeah, maybe 2, but those are great results. Okay, so again, if you're going to do, if you're going to have a surgical approach to that, I mean, the price would be 3 times what that is, and the downtime would be much longer than it is with CoolSculpting. Okay, so again, you can see this. This is from the back there. So sometimes these are the kind of areas people kind of complain about. They can see the little line above where their hips are, and you can just see a nice hourglass figure there that was done after CoolSculpting as well. Okay, we're gonna change focus now to EMSCULPT. Are there any questions more than the ones you gave us already?
No questions. We've got some comments from some clients. so
Sure.
we can, want me to go through them?
Are they positive comments?
Yeah, we
Okay.
had a client say that she loved the treatment and she couldn't believe the change after a few months.
Okay, good. So we do get lots of positive feedback, which is wonderful. So EMSCULPT, we're gonna move on to EMSCULPT. So we talk about body contouring, where first thing we talked about was seeing if we could remove and freeze the fat. Now we're talking about EMSCULPT. So EMSCULPT is a non-invasive body contouring device that basically increases your muscle mass and decreases your fat. Okay, so it's a very compact machine, and we'll get Steve to show us again. We'll do a live demonstration, but it's made by BTL. They're really the world leaders in medical devices like this as well. So we start on different areas. So patients can come in and saying they want to kind of kickstart a workout regime. They want to work on the core strength. We talk about this machine here. So what it does is it gives you about 20,000 perfect contractions to different areas of your body. So you can apply the applicators to your triceps, your biceps, your abdomen, your glutes, your calves. And if you were to sit and try to do a workout and try to do sit-ups, you may activate 20 to 30% of your abdominal muscles trying to do a proper sit-up. This gives you 100%, every muscle is being activated, 100% super contractions, they're called. And it's like it overtakes what your brain can possibly do. And you're doing equivalent of 20,000 sit-ups in a 27-minute session. So that's really impressive, right? So anybody who's gone through this program, it's amazing. It's only 4 treatments. So you go 2 treatments every 3 days. You do 4 in total. Come back and see us maybe a month to 3 months later. And then people go on maintenance programs. And anybody who works out in the gym, they can notice everything improving. So their bench is better, their core strength is better. You know, back pain, it improves. So it's really an impressive device. So it works with high intensity focused electromagnetic therapy. Okay, so we'll show you in a second how it works, but you start feeling the contractions. And as I said, it increases muscle mass. So you get hypertrophy, increase in the strength of the muscle fibers, and you also get decrease in the fat. And an area of fat that it helps is what we call the visceral fat. So with CoolSculpt, you see the fat in the exterior. This is that fat inside the abdomen. Okay, so
CoolSculpting is more that soft, pinchable fat, and then with this, it can treat that internal fat, so the fat that's kind of around your organs. If you have that hard stomach.
Yeah. So it can go like in the abdomen, go up to 7 centimeters deep. Arms and calves up to 5 centimeters deep. So this is where it's helping. So as we said, destroys fat cells and increases muscle strength. So why don't we just show exactly what would happen. So if Steve came in for a consult, said, hey, I'm getting my workout regime going. You know, I have a 2-pack, I want a 6-pack. This is kind of what happens. Like our friend up here on the left, same thing. Like you've gone from, you know, these are people who work out, and it can be for anybody, right? So again, it's pretty simple. You come to the clinic, we have you hooked up within 5 minutes, even less than that. We set our timers. It's a 30-minute process. You hit start, and it's as simple as that. You get a short pulse, a long pulse, and a tapping pulse. So Steve, what do you feel right now?
I definitely feel some, let's say, intense muscular contractions.
Yeah.
It feels weird, if anything. It's not painful, it just feels really odd.
Yeah. So really, it's an involuntary muscle contraction. So we've kind of taken control of his muscles through the magnet here, and he's just having multiple muscle contractions. He's actually contracting all the muscles in his abdomen. So all the different layers of muscle in your abdomen are now being contracted. And it increases intensity, increases the length of the pulses. And we slowly go up from, what percentage is he on right now? 15? So up to 15. You'll have a technician with you in the room, and we try to get to 100% pretty quickly. And you feel it the next day. You'll feel like you've had a pretty good ab workout. And you said we did that, come back 3 days later, next week. So 4 treatments, you're getting your abs done, and you're done, basically. It's maintenance. So you go back to the gym, you do your normal activities. And as I said, we can do this in your abdomen, triceps, biceps, glutes. So we probably get the benefits there. You want to, we'll stop them now. And we'll show you something. This is after 4 treatments on this gentleman here. And even right away you see the definition of his abdominal muscles there. So his six pack is well on the way there, and you can actually decrease the amount of even some of the abdominal fat there that you notice as well. So there's definitely a nice improvement. And again, you can see that in the side profile as well. Yeah. Again, so you can see the lip there. If you want to just point that out, Lisa.
So you can tell right in here that her butt has kind of been more lifted.
So it does
More.
have a butt lift,
Yeah.
okay? And again, triceps, bicep. Sometimes there's certain muscles different. So men have trouble getting a six pack. Sometimes women have more trouble getting some definition of their triceps and their biceps. And this works great for it there. You can see that. You see the triceps are formed and also the biceps there. So those are nice before and afters. And again, this isn't after a lot of intense treatment. This is 4 treatments, 3 months later. So this is another example on from left and right. This is just client came in, 4 treatments, saw them back 3 months later, and these are the pictures we're seeing. So this does work. Again, calves. Some people have struggled at developing the muscle mass in their calves, and this is an example there. So yeah. So again, we have a lot of clients are coming in. They know we have this technology. It is state of the art technology. That's there's not a lot of clinics in Southwest Ontario that have this technology. Certainly not a CoolSculpt and the EMSCULPT together. So this is all pretty impressive stuff that we have here. And what would be the contraindications? What reason people won't use the EMSCULPT device?
So if they have a pacemaker,
Yeah.
if they have metal implants in their body other than titanium.
Copper IUD.
Yeah. Any metal, it's a magnet, right? So
yeah.
you don't want any metal in your body to come flying out. Not quite literally, but you'd feel it if you had any metal in your body. So we're obviously we do a full medical history before we have you come in. So again, questions that we may have here. People say why come here? Before we do anything, you'll be assessed by one of the medical professionals, either by myself, by Christina, our nurse practitioner, one of the nurses. We have everybody here that is a licensed healthcare professional. We'll give you a proper history and physical before we start. Okay. So, any questions? I think I have a list of questions.
So we have a question from Sherry
Okay.
asking how much CoolSculpting is.
Okay, so it varies. So again, it's a customized plan, but the minimum you'd probably find is probably $3,000, I would say, for
Yeah.
treatment, and it can
People-
range 3,000, 5,000.
Yeah. Usually people if they're treating their abdomen or their flanks, people that are happy with their treatments usually spend around 3,000 plus.
Okay, so it's not cheap, but when you're looking at those areas that if you're going for obviously surgical, it may be spending $10,000, $15,000, $20,000 on treatment. So it is a more affordable option in most cases than having a surgical intervention.
No risk.
And there's you're not being put to sleep. There's no bleeding risk, etc. So it's a safer way, more affordable way to start off the process that we'd say. And again, it's in conjunction with healthy lifestyle. So we encourage everybody to continue doing what you normally do. But it's you may find that for women, we often have women come in, they finished having their children, they're back at the gym, but the EMSCULPT really helps with, if you see the Diastasis Recti, we have a lot of women who come in and say, my abdominal muscles are split. Is there any treatment for that? We do have a great treatment for that. That is the EMSCULPT treatment, which it works great. So it's not like it's an investment you're making in yourself. 95% of our clients who get this treatment, I would say, are happy with it and often come back and look for more areas, right? So they're sort of their abdomens, they're coming back and they're doing different body parts. So we have a lot of client satisfaction through this process, right? So, and again, it's not one I would say you want to go and price shop it, meaning go for the cheapest place that does kind of discount any service. It's your body, you're investing in yourself. So remember where you're going, the medical assessments you're getting in the process, the healthcare professionals and all the experience you're doing the treatments, because it is operator dependent, and having aggressive treatments, you guys have advanced training to do the advanced treatments, so that there helps as well. We have promotions going on, as we said. So we have a free cycle, so 5 cycles, an extra cycle free. And then we have all our discounts through our membership programs, which most people who are using these services are getting, or actually the membership program. So come in, have a consult. We can tell you all about them. We'll come up with a customized plan for you. I guess the question somebody's asking about other promotions we have. So in addition to this cycle, we have Valentine's Day coming up. So A lot of people are out shopping looking for ideas for Valentine's Day. We're trying to support other local businesses. So for every gift card sold, we're going to give another 10% back to one of 4 different companies and businesses in Sarnia, which we're going to support as well. So we have Paulina's Flowers, we have Tin Fiddler, what do we have?
Ruckle.
We have Ruckle
And Aaliyah Beauty.
and Leah Beauty. So we have four companies that four other businesses we want to support. So we're giving this for free. It's our donation back to them and helping support, especially during this tough time that everybody's having. So come in, buy a gift card, and get another gift card for free that you can use to get a gift card for $250, and you can buy flowers at Paulina's, etc. So that's what we like to do. Any other questions?
So we had some come in through Instagram.
Okay.
How long postpartum can I do these treatments?
Yeah, so I mean, the first one, like basically EMSCULPT, it's once you're back exercising. So it depends. If you've had a C-section, it may be a bit longer. If you're breastfeeding, you probably want to wait till these are done. So it depends. So most people come in 6 to 9 months. If you're breastfeeding after a year, come in after a year. Some people want to kind of, have gone through the breastfeeding process, back at the gym, working out. It's as we said, it's nice when you're down to the last 10, 20 pounds, or those areas where you're having trouble. So yeah, it's whenever you're comfortable coming back and you've been kind of released, but we'll give you a medical assessment here to make sure it's safe.
So these questions kind of go together. Like, how do they work well or complement each other? And another question was, how long after CoolSculpting do you typically have to wait to get EMSCULPT or vice versa?
Okay, yeah. So the question is, basically, how do the two technologies work well together? And is there a time delay between? So CoolSculpting will debulk, right? As we say, so we're getting rid of that fat, and then we're toning. And so if you have like the visceral fat, some of the fat that's kind of inside, it helps with that. CoolSculpting doesn't do that well together. So you start with your CoolSculpting. You don't have to do CoolSculpt first. Some people bypass CoolSculpting and say, I don't need it. I want to work on my arms. I'm not happy with the arms. I want to see that triangle in the back of my arms. I want to see my, in the summer, you have a 1-pack or 2-pack. You want to turn that into a 6-pack. These are things that people come in and ask us about. And it doesn't matter what I do at the gym. I just can't get those results. Then this is a good kind of kickstart. And then you can maintain it through your programs.
Okay, so I have a couple questions that came through Facebook. The first one is, can you do CoolSculpting if you have metal in your body?
Yes, you can. So yeah, it's fine.
It's not EMSCULPT.
Yes.
And then we had somebody inquire about the chin. So if you do the chin area, does the skin under the chin tighten up? How many treatments do we have? More pictures?
Okay. We do have lots of pictures.
Yeah.
But
Yeah, so with treating under the chin, it happens gradually. Usually it happens over the 3 months. So usually your skin kind of has time to really bounce back. But we also have another product here called Elastin Transform that we really love to incorporate with our CoolSculpting treatments. It uses a trihex technology. So the way that works is you put it on twice a day, every day after your treatment, and it actually helps to go in and remove those dead fat cells that we killed with the CoolSculpting, and then it replaces it with new collagen and elastin. So it really prevents you from getting that loose, crepey skin after. It's also removing all of that dead collagen and elastin too, and putting new stuff in.
Yeah. And for some patients who it's still a stubborn area, we have something called Valkyra, which is an injection that we also use. So this is why when you come in, you will do a consult. We have an optical lead as well. So we have a whole consultation that comes in. Come in, it's free. We give you a program, and we discuss, what's the best option for you.
More questions. So
Okay.
Will I see my full results by summer?
Yes, well, that's why we're doing this in January.
Start now.
We start now. So typically we said 3 months. So you get your max result 3 months. If you need a second treatment, that brings you to 6 months. So you should be. This is July, August. You're getting your peak, right? So definitely starting now. Your first one will be as 3 months after that. So if you're getting in for February, this is your results are in May, June.
Will EMSCULPT help with muscles around shoulders that have rotator cuff problems?
Okay, so it's not typically used for rotator cuff. So those are different physiotherapies, but your triceps and biceps are connected. So when you stop using your rotator cuff properly, you start using your biceps and triceps incorrectly, so you can have some muscle atrophy in that whole area. So it doesn't particularly, the cuff are these 4 tendons that go inside your shoulder joint and around your shoulder joint that support it. So it doesn't really help for that, but it definitely helps your biceps and triceps.
Not through Instagram.
Okay, so I want to thank everybody, Steve, Michelle, Lisa, for coming. I really appreciate it. And for everybody taking time out of their Tuesday nights. And now is the time to book a consult. We'd love to have you in. We're doing a great special. The body contouring special for the free cycles are going to extend it past February or past Valentine's Day to the end of February. So make sure you book a consult as soon as you can, and either Elise or Michelle, and we'll bring you through it. So thank you, everybody. If you have any questions, you can.
And we will be giving away a Transform, an Elastin Transform. That's the body lotion that we suggest doing with the treatment, with the Triax technology. So please fill out the RSVP form if you have not.
What is the value of this?
It is $300.
Okay, so it's a $300 prize for somebody who fills out their form. Is it the RSVP? Where do they fill it out?
It's in the description of the video.
Yeah, it's in the description. We'll have it posted on all of our social media. So take a look
Okay,
at Facebook or
take a
Instagram.
look at it and enter to win.
That's right, and we'll announce the winner end of day tomorrow. So please fill the form out tonight if possible.
Okay, again, thanks everybody. And we're doing this again. We do this monthly, as you know. And February 22nd, somebody said? Okay, yes, okay. And we're going to move it to 7:30 because we work until 7, so it's a bit of a rush to get everybody this together. And we'll be talking about injections on that night, okay? So Botox, filler, etc. Okay, so again, thanks very much. Thanks everybody.